Today we are discussing 2 of 4 ways athletes are blood doping. Before we do so, it is important to understand blood cell formation and basic physiology. First and foremost, hemocytoblasts, better known as myeloid stem cells, are the beginning stage of red blood cell production. These cells originate in the red bone marrow and begin their transformation by becoming proerythroblasts, also called a committed cell. Next, the developmental pathway starts with the cell transforming into a basophilic erythroblast. These cells create a large amount of ribosomes. Within the developmental pathway, the cell undergoes multiple divisions while synthesizing hemoglobin and accumulating iron, eventually beginning phase 2. Phase 2 yields a polychromatic erythroblast, followed by an orthochromatic erythroblast. Once the cell has reached this point, it begins its final phase in becoming a young erythrocyte, formerly known as a reticulocyte. This final phase includes the ejection of organelles and pinching off of the nucleus, allowing the cell to take on a bioconcave shape. From hemocytoblast to this phase, 15 days pass. Following the formation of a reticulocyte, intracellular enzymes break down and destroy remaining ribosomes, allowing the cell to become a fully mature erythrocyte within 2 days. Now that we have established an understanding of how red blood cells are formed, we can briefly discuss their role. Essentially, erythrocytes are completely devoted to transportation of oxygen from lungs to tissue cells. As we already know, the more aerobic activity the body does, the harder it has to work to carry out this function. This is why athletes often turn to blood doping. Blood doping is the alteration of one's blood composition in order to increase red blood cell count and hemoglobin content, thus increasing oxygen carrying capability. Athletes use this tactic to train at more competitive levels, recover quicker, and produce greater aerobic endurance. One of the many ways athletes are carrying out this method is through blood transfusions. There are 2 types of blood transfusions athletes are using, autologous and homologous. Homologous blood transfusions involve the transfer of erythrocytes from one individual to another. This method is synonymous to transfusions used as treatment for disease. Autologous is when an athlete uses his or her own blood. In this case, blood is drawn from the athlete, plasma is returned while the remaining erythrocytes are frozen and stored until later use. Athletes return the remaining substances to their body prior to their athletic event. Advantages to autologous transfusions include less risk factors and less detectability than that of homologous transfusions. When performing homologous transfusions, athletes are more prone to infections because the transfusion acts as an immunosuppressant, while diseases such as HIV or hepatitis may be present in the donor's blood. Not only do athletes have a higher risk of infection, but also a higher chance of being caught. Officials now use a test that can detect cheating in 2 different ways. The first test looks at the blood to see that each erythrocyte is composed of the same blood type. The second studies the minor antigens found on the surface of red blood cells. By looking at these antigens, officials can determine whether the blood is varied or if it's consistent. Unfortunately, athletes do not realize that these quick fixes are more harmful than beneficial. By inserting extra quantities of red blood cells into the body, blood volume increases along with the viscosity of the blood, resulting in slower blood circulation. Slower blood circulation disrupts laminar flow and prompts the heart to work in overdrive. Over time, the heart becomes overworked and the athletes face greater problems such as heart disease. Because the heart is working harder than normal, blood pressure increases, which eventually creates plaque buildup along the lining of blood vessels. These plaque buildups can rupture, causing a rush of platelets to the injury site. Because the rupture is not external, the platelets form an embolism inside the unbroken vessel, ultimately preventing blood flow. Without proper blood flow, the portion of the heart, which would typically receive that blood, may die, leading to heart attack.